Hey guys, welcome back to my YouTube channel. And if you're new here, welcome. My name is Kofo, and here we talk about everything been in our 20s, faith, lifestyle, growth, and just a little bit of nursing. If everything here interests you, please make sure to like, comment, and subscribe. So, yeah, let's get into the video. Today, I would be talking about being a nurse in Canada versus the USA. If you guys know, I just moved to Canada at the beginning of the year in 2025. Yeah. And so far, uh, I'm liking it. I would say there are some cons, of course, as there is to everything. And yeah, I will be talking about that in this video. I would like to preface that everything I'm going to talk about right now depends on where I practiced and what state and the hospital. So when I was in the States, I was in Washington, D.C., and right now I'm in Vancouver, Canada. So yeah, and then secondly, I would also say that it depends on like whether your hospital is unionized or not. So in the States, my hospital wasn't unionized, but right now my hospital is unionized. So I think that also there's also differences with that as well. The first thing I would like to talk about is nursing salaries and earning potential. As we all know, salaries in the States are considerably higher than in Canada, and that is even excluding the exchange rate. And this obviously depends on the state you practice in. Because I remember, I'm going to compare California kind of to Vancouver because I think that they're sort of similar in like standard of living, nursing laws, and how like nursing is kind of talked about. So yeah, I remember when I was applying to nursing like jobs when I just graduated. I applied to a lot of nursing jobs in California, and the average starting pay was around 50 USD, while in Vancouver, BC, it's 42, around 42, depending on the specialty. But yeah, the base salary per hour is around 42 CAD. So that's the first thing. And I would also like to mention that at the time of my application, when I just graduated nursing school, there were states in the US that still paid quite low, like Florida and Texas. So I don't know if it's like similar pay or it's increased, but I would also like to mention that because I remember applying and the pay was quite low. So I also want to talk about like salary progression. In the states with the hospital I was working at, we had a pay increase of about 3.3% every year. And in Vancouver, BC, it's about 3.8% increase every year. So, for example, if you're earning, let's say, $40 this year, in the States, in your second year, it would be 3.3% higher. So, and vice versa for Canada. In terms of growth opportunities, I would say that both places are quite similar, but Canada is just maybe starting to catch up. So, what do I mean by that? For example, if you wanted to go from the med surg unit to the ICU, for example, um, I remember talking to some colleagues at work where I work right now, and they said that like if you were a new grad, it was quite uncommon to like go into the ICU immediately, and that was something that started like in the recent years. But if you were like working in med surg, there are a lot of like programs and like opportunities to kind of go from the med surg to the ICU. You could even shadow for a couple of days to see how the ICU is and if you like it. Um, and I think that was the same as well in my hospital. And in my hospital, it seems that they've been getting um, new grads in the ICU for a little bit now, although it was introduced not so long ago as well, but I think they've been having that for a while. Um, yeah, so there are a lot of opportunities here in Canada and in the States as well. One thing I do want to mention is that here in Canada, I think you would have to maybe like do a maybe while in school you would work here or shadow while in school so that you could get into the ICU immediately. I don't know if they would accept other people from other hospitals outside of the province. But yeah, and then in the hospital I worked at in the States, I just did a preceptorship in the ICU during my last semester in nursing school, and I was accepted into probably all of the ICUs I applied to. In terms of getting into the ICU in the States, it was an intensive program. I remember it was for 5 months, and we did like a bunch of classes. We even had to do exams like critical care exams, EKG exams. Did like maybe 3 months of like being under a preceptor. Yeah, it was quite intensive. I remember being so stressed about it. I don't know. I'm not really sure about how it is here in Canada, but getting into the ICU as a new grad boy in the States it was quite intense where I work. But what I can talk about is getting into the ICU or getting a job in the ICU with 1 year of experience in the States and how I was able to transition and what the process looked like. So I remember when I was trying to get ICU jobs in Canada, most of the people that, or not most of the people, but the people that were helping me apply would say that you would most likely not get a job in the ICU, da 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 da. But I actually ended up getting all of my interviews were for the ICU. But yeah, and when I got in, I what did I do? So we took like obviously like classes on like the equipment they use and things like that. And it wasn't even that like serious. Um as it was in the States. And also, I did like 12 shifts in total under preceptors, of course. Uh, so that was like, for like a month. So the whole thing in total to like eventually start working independently was for a month and a half. So yeah, I would say it was a seamless, smooth process. Like there was an IN program, which basically means internationally educated nurses, where they would check up this, and they still do actually. They would check up on you, every couple of weeks to see how you're doing, to see if you need any help. Um, they just had a bunch of resources to actually help adjust to the system. And I also think that it helps that it wasn't too different from what I knew, you know, in the States. But yeah, it was very smooth. The process and the transition was very smooth. In terms of overtime and bonus opportunities, guys, I've barely gotten any overtime opportunities here. Like I think I've only gotten one since I've worked here and it sucks. But yeah, reason why it's so hard is number one, it's based on seniority because it's unionized. And I also think we've not been as busy at work, and the IC is well staffed. So, and people are constantly picking overtime, and I'll talk about that later why people pick overtime. I actually think people pick, I can talk about it now actually. I think people pick overtime because in our ICU, it's pretty easy to, well, not pretty easy, but like the whole, actually, I'll talk about that later. But yeah, I've not really had any overtime opportunities and it's really hard to, and I hate it. But yeah, it is what it is. Um, the base pay is okay for me to live on, so that's good. In terms of bonus opportunities, I think it's quite similar in the States as well. Like if you here, if it's a, let's say, a short notice shift where they would need someone to come in, there's even extra pay on top of working overtime. And then what else? I would say that if you work like holidays, you also get extra pay. And that's the same in the state as well, especially with the holidays. So I would say in terms of bonus opportunities, it's basically the same. The second thing I want to touch on is work environment and lifestyle. In terms of the work environment, here in Canada, the hospital I work at, it's not self scheduling. You just get a schedule that is basically for like 1 year and more. And it's basically like 2 days, 2 nights, and 5 days up. 2 days, 2 nights, 5 days up for the most part. Personally, I don't mind it at all because I do not have like specific um things I need to do. I don't have a lot of that. And secondly, I actually prefer clustering my shifts. That's usually how I like it. And then having a lot of days off. So I personally don't mind that at all. But we also have self-scheduling opportunities. So there are nurses that came up with like, their own schedule where like if you want to self-schedule, you can do that as long as the units needs are met. But there's some things you would have to sacrifice, but yet there's also opportunities for that as well. Like the states where I worked at, it was self-scheduling where we would just like schedule ourselves, and as long as we meet our requirements, which for me it was 9 nights and 6 weekends in a 6 week period. So as long as we meet that, you would most likely get approved for your shifts. Yeah, and at first when I heard it wasn't self-scheduling, I was kind of upset. I was like, whoa, and but it's actually not that bad, and I actually don't mind both. So yeah, that's basically how it is. And I also wanted to mention that my hospital, you can also like swap shifts, and they have like Facebook groups where you can swap shifts with people. Another thing is, in terms of the requirements in the States with the 9 nights and 6 weekends, the requirements reduced as you obviously spent more time in the hospital. Also, in terms of breaks, in my hospital, we get three different breaks on day shift. So we have two 30 to 45-minute breaks each. So like 30 to 45 minutes break, then a 45 minutes to an hour lunch break, and then a 30 to 45-minute break again. So the break was quite good, and we actually got paid 11.15 for 11.15 hours. So like how in this state we get paid for the 12-hour shifts we work. In Canada, that's the difference. You get paid for 15.15 hours. Yeah, so the break here is quite good. And then on night shifts, we actually get one 45-minute break in the evening to like eat our like dinner, and then we get a 2 hour sleep break. So pretty good. Pretty good stuff. And then in the States, we got 1 hour break that you could possibly use however you like. So you could do a 15, 30, 15, or you could do like an hour break. Well, in the States, the nice thing is that you got paid the moment you clocked in till the moment you clock out. So yeah, obviously that makes the pay even a little bit more higher. In terms of like opportunities with things other than full time, it's basically the same in Canada and in the States. In Canada, we have something called, you could work part time, and then you could also do casual where you could work as much as you want. So you can work as much or as little as you want. In the States where I worked, it was called PRN instead of casual. So I don't know if it's maybe like equivalent to each other, but PRN is basically as needed, and then you could also work part time as well. The work culture at my workplace in Canada is pretty much the same with the work culture at the place I worked in the States, because we were expected to help each other and to work as a team. But I think for me personally, from what I've noticed, it's more of a thing here in Canada, or maybe they're just too nice, because I'm telling you, like, the people at my workplace are super, super nice and lovely. And the people at my workplace in the States were super nice and lovely too, but I just felt like it was a more intense environment, and people were more like, so I kind of understand that. Because another thing is, it's only 1-to-1 in the ICU here. So remember, I worked in the ICU, so it's 1-to-1. In the States, it was 1-to-2. So one nurse has two patients. Here, we only have one patient. So I guess people are just more prone to help each other because we're not as busy. Unlike the States, people had to deal with their own two patients. So, it's probably harder to even be helping another extra person. So I kind of understand it. So I would say in terms of the work culture is quite similar. In terms of responsibilities for nurses in Canada, I would say it's lesser. So where I work, we do not have to get IVs. We do not have to get peripheral blood cultures. We do not have to get EKGs. We do not need to put in NG tubes. So let me explain this. So to put in an NG tube or to put in an IV, you need to go do this like course and then get certified by someone else that has done it. And I think you need to get certified by three people. So once we have the people that have done it, most people don't do it anymore because we already have those people. So most times we don't have to put in an NG tube. And then with the IVs, we have like the phlebotomies. I think that's how you pronounce it. I'm not sure. That come in and just get it. Even with labs, they just come in and get labs. Like your patient either has an arth line, a central line, and if they don't have any of those, even if they have two PIVs that work, you just need to. The phlebotomies come in and the phlebotomist. How do you pronounce that? But anyways, yeah, they come in and they get those labs. So yeah, the responsibilities are less. Like even EKGs, like you don't have to do it. They come in and do it. When I was in the States, OMG, like and we used ultrasound like to get our IVs in the ICU. So like you would before you can call other people to get you an IV, you would actually need to make sure, sweat and make sure that you absolutely can't get it before you call other people. So yeah, like there's less responsibilities here for nurses in Canada, I would say, compared to the States. In general, I would say that so far I feel less stressed working in Canada. Like I'm not even going to lie, guys. I feel happier. My mental health feels better because I just feel less stressed. Like if you consider the breaks we have, the one-to-one patient, the less responsibilities, and even the fact that I barely get to work any overtime, so I'm generally not overworking myself. Like I feel less stressed, and at the same time, surprisingly, I don't feel that stressed about money either. Like in terms of paying my bills and covering the basics, no. So I would say that in the States, I was overworking myself. I was more stressed. I was just probably more anxious. Even going to work, I was more anxious than going to the place I work here in Canada. So yeah, and that feels great, but I also miss the extra money, of course. So, something I want to mention is the equipment they use in Canada, like in their hospitals, because I know we usually hear that, the equipment in Canada is a little bit outdated, but it's not as bad as you think it is. Like, for example, the ABG testing machines we use in the States, if you guys worked in the ICU, we use the GEM and we also use the portable ones. They don't do that here in Canada, at least in the hospital I work at. Their charting system, we use Par chart in Canada as well, and that's also what I used in the States. We used Par chart Turner. Um, it's a little bit behind, but not too far behind. Like you can't page the doctor through Power Chart, and we could do that at my hospital in the States. In the hospital here in Canada, I work at. Um, we don't have like phones where we can page the doctors or call or be in contact with like doctors or maybe respiratory therapists or other members of the healthcare team. But at my hospital, at the place I used to work at when I was in the States, we had phones where we could at least call the doctor. I'm not talking about the ones and in the nursing stations and things like that. I'm talking about the phones that you could like, the personal ones you could text and you could do things like that. So and then you could also text the rest of the nurses because we also had a really big unit because it was a newer build. So we had that. We don't have that here. Another thing is here in the hospital I work at, they use Omnicell. In the hospital I worked at in the States, we use the Pyxis. Um, both hospitals I've worked at use the LRS pumps. I'm trying to think of other things. Here, when we like check in, we actually have to sign our names. Well, at my hospital in the States, we just badged in and badged out. So, and that's crazy because if you don't sign in, you won't get paid. So that's crazy. Yeah. And also here with medications, we have to mix the initial like bags of like Narapi, vasopressin. Like let's say we need it right now, we have to mix those bags before, and then the next doses would be gotten from pharmacy. And another thing I noticed is they don't use ultrasound to get like IVs. Unlike the hospital in the States, we used ultrasound to get IVs. I also think CRRT is a little bit different and maybe a little bit behind. But I haven't started doing I haven't been CRT trained yet in the States and both and in Canada as well. But yeah, that's all I can think of. Let me know if you guys have any other differences in the comments below. The next thing I want to talk about is education and licensing requirements. In terms of education, I would say it's pretty similar or probably similar. So my cousin goes to nursing school. Goes she's in school for nursing, but she's in school for nursing in Alberta. And I did ask her what the education was like, and I asked her if there was like pre nursing and nursing school like it is in the States, and she was like, no, like it's just nursing. So I would say that that's probably something that is different. I don't know how it is in Vancouver, but in Alberta, that is how it is. There's no like pre nursing and then nursing school. It's just like nursing, and it's a 4 year degree as well as it is in the States. I've even heard that some nursing programs are like I think 4.5 years in the States or 5 years. I'm not sure, but I've heard that it is, it can be up to 5 years as well in the States. And to eventually become a licensed nurse, it's the same exam, it's the NCLEX exam. And I've heard also that it's basically the same exam. So, yeah, the exam is the same as it is in Canada versus the US of A. In terms of the licensing process, I've been told that it's a little harder to get your license in BC than in Alberta, and it's faster. So yeah, if you're thinking about getting your license faster, Alberta would probably be the place for you. But when I was doing my licensing process for BC, I had to submit a couple of documents like notarized IDs and maybe other ones. Let me know if you guys want me to talk about the whole process more in depth. Let me know in the comments below. But yeah, I had to send a couple of documents to, I think, Inspire first, then kind of send some of those documents, more of those documents to BCCNM, which is the licensing body here. I think the full name is British Columbia College of Midwives and Nursing, something like that. I'm not sure. But yeah, and it was like a whole process. I had to get like reference from my manager or my director in my former workplace. I also had to they she also had to fill in something as well. But yeah, it was a little bit of work. Another thing I had to do was like send transcripts through Wes. I think some of you might know about Wes. It's basically an organization that helps to kind of transcribe, maybe not transcribe, but send your transcripts to BCCNM, so the where I was trying to get a license, and so that they can kind of see and compare if the curriculum in the States or where I went to school is similar to what they have in BC or in Vancouver in Canada. So I'm going to kind of talk briefly about the process. So West usually takes about maybe 2 weeks max, but it took 2 months. So I actually don't have a proper timeline for how long the whole licensing process takes. So instead of West taking 2 weeks max, it took about 2 months. So when my West stuff finally happened and BCCNM received my transcripts, they actually got back to me quite quickly, as well as Inspire. It got back to me quite quickly and they gave me my provisional license initially. So the provisional license was basically saying that we're giving you this license if you do the following. So once I start working in Canada, I needed to do 250 hours of TPE. So that's called transitional practice experience, where when I started working independently, after 250 hours, my like educators would have to like fill in something and send it to BCCNM. And then the second thing I had to fulfill, the second requirement I had to fulfill was do an introduction to Canada's healthcare course. So yeah, I was planning on doing all of that, but then I recently, not too long ago, got reached out to, and I was told that I would no longer need to do any of those because the my education in the States is widely recognized in Canada. So yeah, that has been cancelled. So if you're planning on coming from the States to Canada as a nurse, you basically don't have to do anything. Yeah, you don't have to take another exam. You don't have to fulfill anything. You don't have to take a course. You just need to make sure that you send all your stuff to BCCNM for them to confirm. And yeah, you're good to go. So in DC, when I was applying to get my DC license through endorsement, which basically means that you're getting that license out of state, it was actually meant to take longer, but because I had a short period of time from when I applied to when I was going to start, I was going to need to start working. Um, my organization, my hospital, basically reached out to the DC Board of Nursing, and I ended up getting my license quicker. So I was told that it takes about maybe like at least a month. But it took like, I don't even think it took up to 2 weeks. But yeah, can I just say, getting a license in BC, so that's in Canada, for BC specifically, not for other provinces, is super expensive. Like, it's so expensive, guys. Like, for me to renew, I don't remember the specific amount I paid to get the license itself, but to renew the license, I had to pay $800. I didn't get reimbursed by my hospital, but still, that is crazy. For DC, the cost of getting my license through the endorsement was $230. The cost of renewal is $145. So yeah, it's way less cheaper than $800 to renew. That's crazy, guys. So let's talk about the healthcare system and patient care in Canada. Canada's healthcare system is perceived as more universal and accessible with fewer financial barriers for patients. However, there are accessibility issues. So, because it's basically free healthcare in Canada, people have to wait months to get surgery. People sometimes have to wait months to see their general practitioner. So sometimes it can be tough getting the urgent care you need. Especially because the supply is limited compared to the demand. So the supply of healthcare providers is not meeting the demand for the amount of healthcare that is needed. Whereas the states, while offering more private options and potentially faster access to some specialized services, is more expensive and leaves some people uninsured. Both countries face challenges in terms of a shortage of nurses. While I think the US system puts a greater strain on nurses due to a higher workload and a more complex system. So let's talk about immigration and visa considerations. I'm going to talk briefly on this. Let me know again in the comments if you want me to talk more on this. But yeah, I'll be talking briefly about this because I think it's very intricate and detailed, and there's a lot to consider here. In general, getting to Canada would be an easier process if you're from the States, compared to if you are from Canada trying to go to the States. And that's just because of the immigration laws. If we compare both, Canada is a smaller country and they need people. They do need healthcare providers. They need healthcare workers to help meet the demand. So yeah, whereas the US is already so over, it's so filled up with so many people, but that doesn't mean they do not need nurses and they don't need healthcare workers. I just feel like in the States, it's just more complicated to kind of get into the system quicker. But if you find the right like agencies to help with your journey and process of like maybe coming to Canada or going to the States, I think you can definitely get into these two countries. So it's just about finding the right agencies to help and being patient. So that's all I have for you guys. Let me know if you liked this video, and if you liked it, please actually like it. Comment what you think, and if you have any, opinion. And yeah, make sure to subscribe as well, and I'll see you guys in the next video.